Okay, so I think we're going to go ahead and get started. So, hello, my name is Bryony, and I'm from MQ Mental Health Research, and I'm here this lunchtime to give you a very brief introduction to some of the more recent discoveries in mental health that MQ has had the privilege of being involved in. Now, before I begin, I should let you know that I am not a psychologist and I'm not a medical professional, and I'm not here to give any personal advice about treatment or anyone's individual circumstances. But I am part of a team who is passionate about improving the way we treat mental illnesses. So my role at MQ is to share and make accessible some of the incredible research successes that we have had, and to tell you how you can get involved in research too. But first of all, who are we? Well, MQ Mental Health Research is the only charity that exclusively invests in scientific research into mental health. So through funding research, we aim to achieve three things. Firstly, to improve our understanding of how and why mental illness first occurs, which will help to speed up diagnosis. Secondly, to improve the treatment of mental illness, because we believe that everyone should have rapid access to a mental health treatment that works for them. And thirdly, we're working towards preventing illnesses before they begin. So looking at the factors that might put people at risk and developing interventions to stop mental illness from developing in the first place. All of our research is of the highest caliber. It's data-driven, it's evidence-based, and we only work with the best institutions and universities. We make sure that all of the investments we make are sustainable and that they're impactful and that they challenge inequalities. So we work inclusively with people with lived experience of mental health issues to involve and engage them in research. Our approach to research is collaborative. So we bring together different disciplines to work together. So psychologists, neurobiologists, mental health professionals, and people with lived experience to really make sure that we take a holistic mind, body, brain approach to research. So MQ was founded in 2013, and since then we've invested in research all around the world, including in low to middle income countries. And one of the reasons that we invest worldwide is we recognise that we need to take a global approach to solving a global problem like mental illness. So you're going to hear now from one of the experts that MQ has worked with. It's Professor Helen Fisher from King's College London. Now, Helen was really sad to not be here today, but she's recorded a video in advance for us.
Hello, my name is Professor Helen Fisher, and I work at the Institute of Psychiatry, Psychology and Neuroscience at King's College London. My research seeks to understand the social, biological and wider environmental factors that cause young people to develop mental illnesses and what we can do to protect them. Over the last 18 months, the world has witnessed firsthand the incredible results that targeted investment in research can produce. The vaccination for COVID-19 would not have been possible to create so quickly were it not for the dedication of the scientists involved and the support and resources provided to them. That's the power of research. And when properly invested in, the results can be life-changing. MQ supports vital mental health research to help us further our understanding of mental illnesses so that we can develop more effective treatments and interventions for the 1 in 4 of us who are affected by a mental health condition. I'm incredibly proud to have had 2 of my projects funded by MQ. For example, they supported my research into childhood psychotic symptoms, which include hearing voices, seeing things that aren't there, and having unusual beliefs. 1 in 20 children will experience these symptoms, and as a result are more likely to develop severe mental illnesses. Because of MQ's support, my team were able to uncover the key factors that lead to the development of these symptoms, including being victimized in childhood, alterations in how genes operate, and exposure to air pollution, as well as discover how social support and other factors can protect children from developing these symptoms. My clinical colleagues are now using that information to create interventions to ensure that the most vulnerable children get the right support early. And this provides real hope that we can stop severe mental illnesses from ever occurring. Since then, I've joined MQ's Science Council, and I'm now part of the panel who determines what studies MQ is going to support. There have been some incredible findings from the research MQ has invested in over the last few years, but there's always so much more to do and more to learn. Today, more and more people are opening up and talking about their mental health, which is just fantastic. But there's lots more support and initiatives out there too. But without research, it's all just guesswork as to what is actually effective. My hope is that we will be able to fund more research now and in the future to help improve outcomes for young people who are suffering today and to prevent people from becoming ill in the future. Thank you.
So that was the wonderful Professor Helen Fisher, who, as she mentioned, has had 2 studies funded by MQ. But now I'm going to tell you about some of the other studies that MQ has supported and the discoveries that they have made. So first off, an MQ fellow, Dr. Bronwyn Graham from the University of New South Wales in Sydney, found that women's estrogen levels have a huge impact on how successful therapies for anxiety disorders are. So during a woman's monthly cycle, when their estrogen levels are low, treatments are less effective. So this study found that by scheduling treatments for women to coincide when their estrogen levels are high, women will be more likely to get better and stay better following therapy. So this can make a huge difference to women like Louisa Rose, pictured here. So Louisa is an MQ ambassador. She's a social media consultant and a mum of 2, and she was diagnosed with depression and anxiety at the age of just 16. Over the years, she's been on and off antidepressants and in and out of therapy. Now, Louisa is a campaigner for MQ and for research because she understands that it's studies like this that can help people like her. Now, it's been known for quite some time that folic acid protects fetuses from developing conditions like spina bifida. But pioneering MQ research has also found that consuming folic acid during pregnancy can protect against children from developing psychosis. So this research was run by Dr. Joshua Rotman, who is based at Harvard University in Massachusetts. And he and his team found an associated link between exposure to folic acid in the womb and the risk of psychosis. So to put it very simply, increased consumption of folic acid during pregnancy prevents the premature thinning of the cerebral cortex, which is the outer layer of the brain. Now, this does naturally get thinner in adolescence anyway, but if it happens too early or too fast, then it significantly increases the risk of serious mental illnesses such as schizophrenia and psychosis. So since this study, we have been delighted to see a recent and very significant policy change in the UK. So now bread products are going to be fortified with folic acid to help protect children. Up until recently, the UK was one of the only Western countries that didn't fortify food, and it was due to the strength of research just like this that helped push that policy over the line. Post-traumatic stress disorder, or PTSD, is a huge area of study for MQ, and there are 2 research projects of note. So first, Dr. Johann Graf from Switzerland identified the group of brain cells involved in both storing and rewriting traumatic memories. So his research supported the notion that facing your fears could be the most successful way to overcome trauma. And this discovery has just absolutely opened the gates for future research to find and test better treatments for PTSD. The second study is by Dr. Jennifer Wild from Oxford University. And since the start of the pandemic, she has been trialling a new intervention for healthcare staff, which is aimed at preventing them from developing PTSD, which is a very real concern given what many doctors and nurses have had to face over the last 18 months. So her study is ongoing, but she has had some fantastic results so far and is really confident that the new treatment is going to be considered a success. Now, Dr. Wild's study is a great example of how MQ can quickly react to new developments. So when COVID hit, we were able to adapt and invest in this and other COVID-related studies. And you can hear about some of these in the COVID webinar, which is on Friday, the 15th of October. So please do sign up to that if you're interested on our LinkedIn page. So this is Dr. Gholam Kandekar from Cambridge University, and he has been investigating the role of inflammation in depression. So the link between heart disease and depression is already very well documented. So people with heart disease are more likely to suffer from depression, and the opposite is also true. So people who've had a heart attack are at significantly higher risk of developing depression. And if someone who's had a parent pass away from heart disease, then they are 20% more likely to develop depression at some point in their life. However, it wasn't until Dr. Gholam Kandekar started to investigate that inflammation mechanisms were identified as the link. So his research identified triglycerides, which are a type of fat that's present in our blood, and that they are likely to be the underlying risk factor in depression. A big focus of Dr. Kandekar's research was on the link between smoking and inflammation, and therefore depression. So this study has also helped to inform health policy around smoking. Now, more research in this area is now being carried out based on Gholam's findings, including his own clinical trial, where he's examining if an anti-inflammatory treatment can be effective in treating depression. So one of MQ's biggest investments was into a project that aimed to speed up research by creating an unprecedented new resource for scientists and policymakers. So thousands of pieces of health data are collected every day, whether that's in schools, GP clinics or hospitals. And all of this data, if researchers were able to access it, would provide crucial insight into adolescent mental health and can help us to identify the trends and therefore tackle some of the major challenges that young people face today. But with all of this data being in different places and accessed in different ways, it's really time consuming and difficult for scientists and policymakers to really get the results that they need. So the Adolescent Data Platform, or the ADP, anonymizes this data and brings it together under one roof, preparing it so that it's really easy to work with and speed up the research. Now, currently, this project is only active in Wales, but it is still the biggest platform of its kind. In total, there are billions of pieces of data all included in the ADP, and they range from administrative health data to social and educational data to psychological and clinical data, as well as information from other research studies. And it's all held within the secure data bank at Swansea University Medical School. Now, already, this project has identified an issue with self-harm in teenagers, and that resulted in new guidance being issued to teachers and local authorities, as well as advice for primary care practitioners on depression management in young people. So the ADP project was led by Professor Anne John from Swansea University, and due to its success, she has now been awarded a further £2 million in funding from the Medical Research Council for a UK-wide hub called Datamined. So this additional funding and this much larger UK-wide project was only made possible by MQ's support of the ADP. So this new Datamined will allow a wide range of collaborations between schools, clinical institutions, universities, charities and industry to advance mental health in a holistic manner. So after 8 years, MQ has become experts in targeting investment to ensure the biggest impact. So 4 years ago, MQ invested £225,000 in a study by Dr. Pingo here on the left, who was examining the impact of bullying on mental health. Dr. Pingo had a quick win very early on, as he was able to identify the link between childhood bullying and adult mental health problems. So with MQ's support, he was then able to develop practical applications through his research. And last year, new guidance was issued to schools throughout England and Wales. So through this targeted investment of £225,000 from MQ, millions of children now and in the future will receive better evidence-based support. Now, this is something that really could have helped one of our ambassadors, AJ Sunny, who's here holding the sign. So AJ is a spoken word artist, and he was bullied throughout his time at school. And it wasn't until he was an adult that he was actually diagnosed with autism. But AJ now uses his experiences to raise awareness about mental health through his music. And he has met all sorts of different celebrities like Stormzy and Rita Ora. Now, unfortunately, mental health research is severely underfunded, and I'll talk a little bit more about that in a moment. But one of the knock-on effects of that underfunding is that researchers end up leaving the field and branching out into different areas of research, such as physical health and medicine. So here at MQ, through our Fellows programme, we invest in early career researchers to help retain talent within the sector. So Dr. Ethel Mpungu from Uganda was one of MQ's very first fellows. So she was really struggling to get any sort of funding for her work in Uganda, and she was actually close to leaving the field when MQ agreed to fund her work. So her study involved training healthcare workers to deliver group therapies to isolated communities in Uganda who were living with HIV. And her study has had some fantastic results. So for the people who took part in her study, they found better adherence to HIV medication, so their physical health improved. They took part in study sessions which improved their income generating skills, which improved their financial status, and they saw a reduction across the board in depressive symptoms. Now, Ethel's work has been internationally recognised, and it's already been trialled across several other African nations. And then last year, she was named one of the BBC's 100 most influential women in the world. So this is the last study that I'm going to talk about, but this is actually one of my favourite projects. So the IDEA project, or the Identifying Depression in Early Adolescence project, is an international study, and it spanned the UK, Brazil, Nepal and Nigeria, and it used biology, genetics, sociology and anthropology to successfully develop a tool to predict which young people are at risk of developing depression in later life. So let that sink in a little bit. Imagine the impact that this tool can have. If every school and GP surgery in the world can use this tool to determine if a child is at risk, then they can make sure that that child gets help to stop clinical depression before it takes hold. So just think of the generational impact that this one study can have. Now, you may have noticed that a lot of MQ studies focus on children and young people's mental health, and there is a reason for that. 75% of mental illnesses develop in childhood. However, of all of the research that is done into mental illnesses, only around a quarter actually focus on children's health. For many years now, very little has been invested into mental health research. So per person affected by a mental health issue, only £9 a year gets spent on research. So to put that into perspective, per person affected by cancer, £228 is spent on research, so about 25 times more. Now, obviously, no one would ever suggest that we should spend less on finding cures for cancer, but we also need to be learning more about our mental health. Our understanding of how different conditions manifest and take hold is just way behind where it should be after all of these years and years of underfunding. If you were to compare what we know and how we treat physical health issues with what we know and how we treat mental health issues, we're at about the leeches and bloodletting stage at the moment. So now you've heard a little bit about some of the more recent discoveries in mental health research. Here is how you can get involved. So in 2019, MQ launched a brand new platform where researchers can recruit volunteers to take part in research online. So this website, called Participate, has so far matched over 15,000 volunteers with researchers who are investigating a whole range of different health conditions. And we'll put a link in the chat to Participate so that you can go and take a look. These are some real quotes from some of the volunteers who participated in a study for novel treatments for anxiety. So as you can see, they found taking part in the research highly beneficial. Many of the studies on Participate are conducted remotely, and that means that anyone can take part. And very often, the researchers need control groups of people with no mental health conditions. So even if you don't have any symptoms, you can still take part in research and you can be part of the next breakthrough in mental health. Now, we are a charity and we do rely on donations to fund our work. So if you've been inspired by any of the discoveries that I've mentioned today, then please feel free to chip in a couple of quid each month, and you can sign up through our website. The second thing you can do is to take part in research through our Participate platform. As I said, many of the studies are online and just involve short questionnaires and surveys, but some of them are also in person, so you can be as involved as you want. And lastly, if the company you work for runs a charity partnership scheme, then why not nominate MQ? And if there happens to be anyone from Deutsche Bank on the webinar today, then please make sure that you vote for MQ on the 11th of October to be Deutsche Bank's next charity partner. There are many initiatives for mental health out there. There's lots of awareness raising campaigns and services being offered, but without the research to back it all up, it's just guesswork. So thank you very much for your time today. If you've enjoyed today's webinar, then please do come along to our next one, which is on Tuesday. Tuesday's one will be hosted by MQ CEO Lee Milligan, who will be joined by Chris Parsons to talk about his own experiences with depression and how research can help. You can sign up to this and all of our lunchtime learning webinars on LinkedIn. And if you have any feedback on this webinar or any suggestions for future topics, then please do get in touch and let us know. So if any of you have any questions at all, please feel free to reach out to a member of the MQ team and we will be very happy to help. You can find all of our contact details on our website, which is www.mqmentalhealth.org. So thank you very much. I really enjoyed talking to you today for this webinar. As I said, please do get in touch with us if you've got any questions or if you'd like to see anything more covered in this topic, in this series of webinars. And have a great afternoon. Thank you very much.